Hi, everyone. I'm going to start in a few seconds here. All right. Welcome to the SRTR Task 5 update webinar. My name is Mona Shatter. I am the Marketing and Communications Director for the SRTR contract. We'd like to thank HRSA for funding the work completed under this task. And given the short amount of time that we have together, we are going to begin. Our presentation today will be given by Dr. John Snyder, the Director of the Scientific Registry of Transplant Recipients, Dr. Corey Schaffhausen, SRTR Human-Centered Design Engineer and Visionary behind the Transplant System Map, and Dr. Allison Hart, SRTR Deputy Director. We may have a limited amount of time at the end of this presentation for questions. If you do have questions, use the Q&A box at the bottom of your window. If we are unable to get to questions, we do plan on answering them and posting the answers publicly on the SRTR website. And with that, I turn it over to Dr. John Snyder. John?
Yes, good afternoon, everybody, and thank you for joining us for this update on our Task 5 efforts. Our objective today is to really go through just a high-level detail of what this Task 5 is and continues to be, how we obtained all of the recommendations we obtained back in year 2022 as part of this 5-year project, the accomplishments we've been able to make over this time period, as well as things that are still ongoing. Um, for those of you unfamiliar with this task, within the Scientific Registry of Transplant Recipients, task orders that we have from HRSA was this process to gather feedback from our community about things that are important to them that the SRTR could potentially provide data and information about to our public, both on the professional side as well as our patient and family side, caregivers, as well as others affiliated with the transplant process in the United States. And so we had established, this is a 5-year project, and we had established this wheel that we show here on the right, where it would be a multi-year cycle where we would plan for gathering feedback from our community. We would host a conference in phase 2. We would then implement those recommendations and then evaluate them over a 3-year cycle. So this project began in calendar year 2020, late in 2020, and we did this planning phase for this initial conference that was held in the summer of 2022 in Minneapolis. I'll talk more about that. And then in the following 3 years, we were in this phase 3 of implementation. And then we are tasked with evaluating progress, updating our community about the progress, continuing to hear feedback, and then planning. And then hopefully we will have in future years the ability to host follow-up conferences as well. So that is what our objective is here today, is we are in this phase 4 evaluating progress and planning for future goals as well. So thanks again for joining, and I echo Mona's thoughts in thanking HRSA for what I believe was one of the most important tasks of the SRTR contract work over the past 5-year period. So this is, again, a bit of the timeline that has brought us to today. On the left, you see the cover page of the conference that we hosted in 2022. We called it our People-Driven Transplant Metrics Conference. It was, I think, a wonderful event. I certainly enjoyed interacting with our community and hearing all of the wonderful feedback. And we had so many volunteers that helped us gather that feedback. And we had just a very engaged audience participation. And so I think it's been a phenomenal process. But this, again, the timeline is shown here at the right. We formed a steering committee early on in 2021 that helped us execute this conference in 2022. We then created and published a report of that conference, which I'll show you in a bit. And we've been working on these recommendations ever since. And so we will assess that today and give you a sense of how you can do that. Certainly in this 1-hour conference, we won't be able to go through all of the recommendations. You'll see the number shortly and how many we received. We're going to hit just highlights, but at the end of the meeting, we will give you a link where you can see very detailed progress notes on each of the recommendations. And we certainly will provide you with a way to get in contact with us if we aren't able to address your questions today. It's how you can get us feedback, and we will certainly respond to all of that. So, a few highlights from our 2022 Consensus Conference. We had 258 attendees at the conference. 25% of those represented patients. And by patients, I'm also including caregivers, this is living donors, this is deceased donor family members, um, certainly the transplant candidates and recipients themselves that made up this. But we were very proud. We worked very hard to make sure we had great patient engagement in this activity. And so we were very proud of what we were able to accomplish and have such great patient engagement in providing these recommendations. It was just instrumental throughout all of the feedback we gathered. That all led to 160 recommendations, so quite a large number. We were really pleased with the breadth and depth of recommendations, many of which we've been able to address, many of which have been deemed to be outside of our current capabilities as the SRTR, potentially outside of the scope of the SRTR contract. I'll give you all those highlights as well, but we're really pleased to receive such a broad set of recommendations from that conference. Many of you are familiar with this. Mona mentioned in her introduction that Dr. Schaffhausen, who you'll be hearing from shortly, really was instrumental in developing this concept. This was a system map that we developed specifically for the conference to help guide us in the discussion. We often had found that when we talk about data or system metrics, it's often useful to anchor ourselves in where in the system are we talking about here. And so Dr. Schaffhausen had this idea that we could display this as a system map akin to a subway system map that many of us are familiar with. And that would at least give us a chance to orient ourselves around where in the system are we talking about, what types of data would be helpful, what information would the patient population find helpful at these various stops along their journey, and then the professionals that come alongside those patients at specific time points, how they would interact with that system as well. So many of you are familiar with this. We have this freely available on our website, and a number of specialized versions of this have been made since, and so you can find those on our site as well. The meeting report in full, the citation is there at the bottom of the screen, was published in the American Journal of Transplantation in their volume 23, issue 7 issue. And so we were very thankful for the engagement of the American Journal of Transplantation in disseminating these results. And we are also very proud that they thought it was important enough to make the cover art of that month's journal edition depict these folks as they're riding what appears to be a subway system, and they have the map behind them in yellow, which was from our conference. And so we were very thankful of AJT's support in disseminating this information. Most of what I will talk about, I won't read this table in detail, but this is an excerpt from that table in the meeting report where we list out just high level what all of these 160 recommendations were. We had them graded with help of our review committee in terms of ease of implementation. We had notes in this discussion topic of whether this came from, say, the patient community, that's the PFD, patient, family, or donor community, or the payer community or professionals. And so there were different categories of who primarily made this recommendation. And then we had some indication of level of priority as we worked with HRSA and our oversight committee, our SRTR review committee, on what we should be focusing on early in this process. So again, this is just an excerpt. This paper is available on the SRTR website as well, and we'll show you where that link is later in the webinar. So what's our overall progress been? It's been a busy 3 years. This is high level. We're going to dig into these recommendations in a bit of detail over the coming hour that we're together. But at a high level, this donut plot to the right here shows that for 25% of these 160, we feel we have completed them. 27% of them are in process, and in process could mean that components have been completed and launched, whereas we're still working on some components related to that as well. So there's differing degrees of what in process means. For example, if there could be things that were recommended across all different organ types, maybe we've completed it in kidney for example, we're still working in heart or lung or liver. That'd be an example of an in process or partially completed task. So a number of those still in the works. We had deemed that about 50 of the recommendations would be deferred. What this means is they were deemed to not be in scope of current SRTR work and tasks. Some brief examples of that would be there were recommendations that to detail which insurance providers various transplant programs accept. Currently, we don't have data like that captured within the OPTN SRTR data systems. So as one of these deferred is not currently in scope of what we're able to do. Another one was to detail out-of-pocket expenses for patients. Similar to this in the payer realm, SRTR does not capture information across all the multitudes of insurance providers that exist in our country in terms of what patients might pay out of pocket. So recommendations like that, while we wanted to capture them during the conference, were deemed to be not currently within the scope of what we're able to accomplish. So we've put them in this deferred category, just to keep them on our radar for potential future revisiting, but not actively working on those. And then finally, 17% still remaining to be addressed. So this gives a high level of what our progress has been. So overall, we're at 52% completed or partially completed in process of the 160 recommendations we received. So we're going to go through some highlights of some of the specific recommendations for the remainder of our time together, just give you a sense of some of the uh, bigger pieces that we've been able to accomplish over the past 3 years. So we're going to start. There was a table 2 in the publication, which we labeled general recommendations. And why these were separated out from the table I showed you before is because they were not specific recommendations for any potential point, any specific point in the subway process map. And so these were detailed in table 2 in the publication. There were 45 of these, looking on the right side of the slide. We've completed 10. We are currently in process on 17 of them. 15 were deferred and 3 were remaining. I would say that the 2 largest highlights from these general recommendations are the patient-friendly SRTR website, which we will show you in some detail, and the System Explorer navigation application that we have been able to spin up and launch for the transplant community. I will be turning it over to Dr. Schaffhausen in a moment to walk you through some of these accomplishments. But before I do so, I just wanted to highlight and thank the many patients, donors, donor family members, caregivers that engaged with us over the past 3 years to develop the patient-friendly version of the SRTR website. I would say that a lot of our energy at the SRTR has been devoted to this website and the tools that we continue to develop and make available within that website environment. There was lots of development, lots of back and forth, many focus groups, working with our Patient and Family Affairs Committee members, gathering feedback, what resonated with them, what could be improved, what could be changed. So a lot of energy devoted over that past 3 years for that website, and we'll be happy to show that to you. So I'm going to turn it over to Dr. Schaffhausen, and he's going to walk us through some of those accomplishments that we've been able to achieve there. So, Corey?
Great, thank you. Yeah, I'm happy to go through some of our highlights for each of the sections and recommendations. This slide is giving a quick snapshot of what John had mentioned as one of our main focus areas to really significantly expand the content that we provide online in a more patient-friendly way and provide more patient-specific content. So the homepage or landing page for patients is shown on the left side here. So if you were to navigate to the preview.srtr.org, you'll see this page. There's also a QR code at the bottom right that you can use to access the site as well. There's a number of different areas that's part of this site. It's been a multi-year process. It actually started several years ago with some dedicated funding provided by HRSA to work with a professional design firm as a contractor to help us create some of these new designs and structure this as a new template or style that we could use across all future SRTR pages. And with this patient-friendly content now launched, we're early in the process to transition all of the existing content into the same environment, and that's sort of ongoing work as well. One of the key pieces of this new environment is to provide information about the patient journey. So there's a few different components to that. John mentioned that we are orienting some of this content around that system map. There is a version of the system map that's on the website that's interactive. There are other versions or other locations on the site where you can access similar content in a more sort of text or Wikipedia style, and that's an example of the page here. So for the specific recommendation in this sort of general category, here is one that requests the SRTR provides education throughout the patient journey, listing some details there. So we've broken this into 5 distinct pages for this section. We're calling these sort of patient journey pages. The next slide goes into a little more detail here. So this is a snapshot of what one of these pages looks like for the early portion of the journey, considering an organ transplant. For each of these pages, the content is structured by the organ type. So we went through all of these the steps in the journey, looking for ways we could make the content relevant to each specific organ type. As John mentioned, we're very thankful for all the patient feedback and engagement we had. That was really instrumental to helping us refine some of these organ-specific information. So to start with some of these pages, you would select what organ type you're interested in. For this page, if you were to select an organ type, it would give you an overview of the different steps in the journey that sort of mimics that system map. In the next page, if you were to click on the organ type, it would expand into a list of questions that are really written and tailored specific to that organ type. So the next page gives some examples of what that would look like. And so you can see here, each of these questions is specific to the organ that you selected, and it's set up as a link. And if you click the link, the content will expand to provide an answer to that question. These answers were vetted by patients and professionals, and we continue to sort of revise them and improve them as we go. The answers provide summary responses, and in some cases, they also provide links to different SRTR resources and other outside resources. We'll have time to go through a little bit of the detail on that. And so, again, for each organ type, there's questions that apply to different stages, and then the next section is getting into sort of the broader navigation for the site. This is a recommendation for having SRTR help users or patients interpret information. This is a very broad recommendation. The graphic here represents what we're using as sort of a starting point, but we are hopeful that we're taking this recommendation to heart for all of the pages, just to attempt, to more effectively use plain language and explain acronyms and make this patient-friendly sort of across the site. The next image here is a similar recommendation to create a guide to navigating all information. So this is sort of zoomed into the image that was on the previous slide as our getting started guide. And I think the key component here is because SRTR does support multiple stakeholder groups, some are professional, some are public, some are patient, we wanted to try and give these users a better way to orient which of the areas on the site is specifically intended for different groups. And so who is this written for? What will you learn? For each key section of the website, we're giving some basic information to help differentiate what type of content or what the intended audience would be. And for the next slide here, a recommendation to help patients or users interpret data. This one, similar to before, to use videos, stories, narratives. The example here on the right is a thumbnail for a recently created new animated video short. This is something we're hoping we may be able to expand in the future, but it just goes through an overview of considerations if someone is interested in exploring organ transplant as an option. So next recommendation for this one, there is a suggestion or request to increase the discoverability of SRTR websites. We do receive this feedback fairly consistently, just hoping that now that there's a lot of investment in these resources, that we're trying to do our best to make sure that the patients can find them and better make use of those resources. So this was really an intentional component of the website development. We worked with the design contractor to think through strategies for search engine optimization, and that was a key part of the way that the website was structured. The image here on the right is a screenshot of a very recent Google search for the phrase "finding a transplant program." You'll see here the SRTR is presented very high in the search results, which is really great to see. And the next image is a similar search using the Microsoft search engine. So we continue to look at ways to improve the discoverability. Search engine is one way. We're also actively exploring partnerships with patient advocacy organizations to help us spread the word and connect us with different membership groups for groups that might find these resources useful. So hopefully with this work and ongoing work, patients who are in need of the information are able to find it. And this segues into the additional resources, which is a specific recommendation as well, to be a trusted source of information and to create links to coordinate content. I did briefly mention for the content on our patient journey pages and the interactive map, in some of those questions, the answer may have already been created by outside organizations. And if that's the case, we're making efforts to link to some of those outside resources, assuming they're trusted resources, so that we don't have to reinvent the wheel for every question. And then we've compiled a list of those links and resources on this separate page. It's shown here, but we have embedded them into the specific questions that may be relevant, so that if you are reviewing these in the journey pages or some of the other sites, you can more easily find them. The recommendation here to enable comparisons of like centers. This was also a very frequent request to allow better comparison of centers. The screenshots here are showing a expanded feature set for the tool that's on SRTR to look up options for transplant centers. In the past, the tool essentially provided a list of centers based on a zip code search, and you would see only the summary of all centers together. And we've expanded this sort of similar to what you might use, comparing to product options or something if you're purchasing online. We've expanded features to allow clicking a checkbox next to a shorter list of centers, and then choosing compare, and you would then see only those selected centers side by side, where you can see greater detail in the metrics and data that's presented. So we're really excited to have this as an option, and it's certainly something that's been a key interest. This recommendation here to create a dashboard of system performance that could be reviewed by any number of transplant initiatives. Here is a screenshot of what we're calling the Donation and Transplant System Explorer. It's really difficult, in a minute or two to fully capture the expansive functionality here. I'd encourage everyone, if you're interested in sort of geeking out on data, to give this a few minutes. It has literally hundreds, potentially thousands of combinations of organ type and metric, and the stratification refers to how the data is separated into different lines. Really a powerful tool to look at how the transplant system is performing. A lot of these are focused on efficiencies, things like how quickly transplants are happening, how quickly organ offers are happening, with that sort of system performance in mind. And I will highlight as well that in the original launch of this, the data was exclusively national, but very recently the functionality has expanded so that the tool will now allow selecting specific OPOs or also selecting specific transplant centers, with the additional feature that multiple transplant centers or OPOs can be compared by selecting multiple options from the list. So again, this is a really powerful tool. We're making regular updates as feedback comes in. So if you were to visit this, months from now, you may see new features compared to today. I'll turn it back to John.
Great. Thank you, Corey, so much. And yeah, I'm just going to start to essentially tease into each of these specific recommendation zones of our system map, and then Corey will give you some highlights from each of these. And we're going to start with the specific set of recommendations that targeted the pre-listing phase. And there were 27 in total recommendations that were upstream of when a patient would be listed for transplant. And those of you that have been around the OPTN SRTR system for a long time understand that generally we don't know about patients until they are listed. And we heard loud and clear from our patients that this is an important upstream component to try to seek information and learn about transplantation before the point of listing. And I would highlight some of the important initiatives that HRSA is spearheading around this to capture information at the time of referral to transplant programs through that evaluation process at Stop C&D. So I encourage you to review those materials as well. And we look forward to being able to address more of these recommendations once we have some of that data capture. But you can see that we've completed 5. We have 9 that are in process. 10 that are deferred, I think, pending this future data capture and this upstream component pre-listing, and 3 remaining to be addressed. And we are going to highlight, I'll turn back to Corey, and he will highlight for you our new predicted waiting time tool for kidney patients that has recently launched.
Great, thank you. So for this example, I'll mention that for the section of recommendations for pre-listing, there are situations like this one where the data that is used is data that is for patients who are listed, but the application or the use case could be to provide that information to patients who are not yet listed. And I think this might be an example in that scenario where we do have data that's available for this pre-listing recommendation, specifically so that patients who are interested in transplant have a better idea of what their waiting time would be. SRTR does provide other similar reports that might give data points like the number of individuals on a waiting list, like a percentage who have a transplant given a certain period of time. We have had specific requests and from this conference as an example to give that estimate in actual years and months. And so this was the focus for the project that's shown here. It's very new. It's sort of launched as a beta version just this week. So we're very eager to have an opportunity to get more feedback on this. I do want to acknowledge a dedicated team of statisticians who have been working very hard on tools like this. So I won't get into a lot of the analytic methods or anything like that, but we have a very experienced team who'd be happy to answer questions if there's anything that comes up related to the specific analytic methods or anything like that. This is a tool that we use to create a process for developing new patient resources as well. So this served as a sort of leading case for SRTR to sort of create a template for the steps that we would like to follow for this tool and for future tools. And that includes engaging with patients through targeted feedback sessions. We also engage with patients who are members of the SRTR Patient and Family Affairs Committee. We reviewed the methods with our Analytic Methods Committee and with the SRTR Review Committee, just to really make sure we're thinking about different approaches and getting feedback and making improvements along the way. And so we're hopeful that the process can be carried forward as much as sort of our sort of focus on addressing the recommendation itself. To kind of go into the details of this specific tool, it is a personalized waiting time prediction app. So the user can enter in a fairly small number of personal characteristics, sex, race, ethnicity, height, as an example here. And the timeline that's shown on the right will be adjusted in essentially real time to provide the predicted number of months or years that individual could expect. And one thing that is, I think, a good learning experience as we work through this tool was how to handle the variation for an outcome like waiting time, which can be very high. And so we wanted to both capture sort of a summary or typical number, and that's shown in bold in the gray box toward the top. But the timeline also provides what is really an accurate representation of the variability. So as an example that's shown here, for the earliest 20% of patients, it might be a much shorter wait, but some patients may actually still be waiting, multiple years longer. And we've heard from feedback that that's a valuable perspective to understand. And so it's been a good opportunity to work through some of those. So as I mentioned, this is now a live tool. We are hopeful that we can expand similar functionality like this into other organ types, and that will be ongoing work.
Great. Thanks so much, Corey. This next phase of recommendations stops E, G, H, and M on our map here, from the time of listing all the way out to an organ offered to the patient, or if the patient is removed from the list before that patient is transplanted. We had 26 recommendations in this zone. 3 have been completed, 7 are in process. We have 5 that are still on our list to tackle. and 11 of these recommendations have been deferred. And I turn it back to Corey. He will highlight for us the shared decision-making tool, which is, I would say, a companion application to the tool that Corey just showed you, and he can walk you through this one. Thank you, Corey.
Yeah, absolutely. So this is a screenshot of a tool that has been available for for a few years already. It does capture a number of different decision points that would be important for patients. One of which would be thinking about, dialysis versus transplant. But specific to this recommendation, it would provide some basic information to help discuss with providers what types of decisions would be appropriate for different categories of donors. And so high KDPI would be one specific to kidney. There would be others related to whether the donor is DCD or other factors that might be important for those decisions. And this tool is available to capture some of those key decision points. One thing I'll highlight, looking at the text of the recommendation, it requests to provide tools that facilitate shared decision making between patients and providers. And I think the key phrase here is in preparation for and at the time of organ offer. And we think a lot about how to sort of meet both of those time points. A lot of the work that is best suited for SRTR has been sort of this upstream time point, sort of preparing for in advance of an offer, because you're able to do that sort of using de-identified information, sort of using statistical modeling to get general ideas about what might be useful at the time that the offer comes in, knowing that other tools that might be available through OPTN or other organizations, could provide real-time information at the time of an offer. So those are overlapping but somewhat separate processes, and the information that I think has been a bigger focus for SRTR has been sort of this in preparation portion. So this is one example. There are other examples that are sort of in the periphery of what SRTR is working on. And by that, I mean there are research-funded projects that are active that involve similar topics, and they hopefully can inform in the future other expanded content, whether that's a more interactive statistical model or a more complete rundown of different types of organs that might be available. Those are things that are in the works. They're not live at this point, but we hope to expand that in the future.
Great, thank you, Corey. Stops I, J, K, L, and N in the map were the post-transplant period from the time of transplantation on through long-term follow-up in the patient journey. We received 18 recommendations in this zone, have completed 7, and are still working on 1, have 9 remaining. The highlights here are 2 applications that are in development, one soon to be launched, the long-term outcomes application. This one stemmed from a number of recommendations. I recall very robust discussion around this at our 2022 consensus conference, this idea that SRTR historically has shown near-term outcomes post-transplant, say 90 days or 1 month or 1 year, 3 years. But it was difficult to find detailed survival information beyond that 3-year period in the SRTR reports. There were some areas of the annual data report that the SRTR publishes annually that contained some outcomes that looked out longer, but certainly not readily available for patients to access in the site. And so this longer term outcomes application has been a strong focus of ours, is finding ways to provide information to patients on longer term outcomes. And then the second one was to provide information for the subset of our population that needs a multi-organ transplant. There were historically on the public SRTR site, you could find information about kidney pancreas transplants or heart lung transplants, which are fairly rare. But these more nuanced combinations, there just really wasn't more information available, even for common ones like simultaneous liver and kidney transplantation. And so the recommendation there was to find a way to provide more information on multi-organ long-term outcomes. Both of these applications are in process as part of these recommendations, and I'll turn back to Corey to just show you what this long-term outcomes application will look like when launched.
Great, thank you. So this slide is giving a screenshot of our very soon to be available Long-Term Outcomes Explorer. What you're seeing is an image from a functional, like fully functional online tool. We did recently make the decision to hold off on the public launch until we could spend a little more time optimizing this app for mobile layouts. So for that reason, we're not able to make this available today, but it should be very soon. One thing that's particularly exciting about this app is that from day one, it is covering multiple organ types, which is sort of a new approach relative to some of our recent examples that are more focused on kidney. So the image here is actually showing the tab that you would use for long-term outcomes after heart transplant, but kidney, liver, and lung are also provided in the same tool, and they would be live at the same time once this is available. Similar to other tools, you can provide some basic characteristics that you are interested in tailoring the results to. This one also has some more professionally focused characteristics that you might be able to discuss with a provider to make sure you're answering correctly. But it is meant to be a very comprehensive set of characteristics that can inform these predictions. The output for the tool is shown as well, so you can see from current time up to 15 years in the future what the predicted survival would be. And this is shown both as a numeric table, so you can just get a sense for the actual percentages, and also as a survival curve. And we heard from feedback, in some of our initial prototype testing with patients that it was helpful to include both. Just to support different preferences for viewing the information, but also just to see visually like how the slope of the line behaves. Is it a line? Is it a curve? Things like that. So this is a really a long sought after addition, and we're hopeful that this is a valuable resource to sort of inform what to expect after transplant. And we can go to the next one. So as John mentioned, another recommendation was to provide long-term outcomes for multi-organ recipients. The tool here is also fully functional. We are in some final refinements, and we have the lead statistician on maternity leave right now. So we're very hopeful that this will also be available without too much more time. The graphic that's shown here is providing the outcome up to 10 years for whatever solid organ transplant combination you select. In this case, if you look in the text at the upper left, you'll see this as heart kidney. Similar to other tools, you can answer some questions to tailor this to specific characteristics. And one key element that's not shown on this slide, just for lack of time, is that this tool also has other components that are meant to essentially just help inform the public about what centers are performing these transplants, especially when they are the less common combinations. So there's a tab that's only focused on presenting a list of transplant centers. And if you are in need of an unusual or less common combination of transplants, it might require a more comprehensive search to find a center that will be a good fit for you. So that's built into this tool, and there's a summary of outcomes that is available for each of the combinations, and the tailored patient-specific outcomes is available for the more common types, heart, kidney being one of them. So we're excited to have this refined and launched, hopefully before too long, and provide this as a new resource.
Great. Thank you so much, Corey. This next set pulls us into the top portion of our subway map, which is dedicated to the deceased organ donation component system through our donor hospitals and our organ procurement organizations that manage this phase of the process of coming from stop O, where we might have a potential organ donor in one of our donor hospitals, all the way through that authorization process and the organs being offered to the centers and the patients themselves through that process. Recovery of the organ at stop R, and then whether or not the organs are transplanted or not. And the family aftercare component was a component of this system as well, as we know that our OPO colleagues are caring for those families long term throughout that process. So we had 21 deceased donor system recommendations. We've completed 10 of them, and we have 4 in process with 3 remaining. The highlights that Corey will touch on here were to provide more information at the donor hospital level, and more information about organ offer acceptance rates within subgroups specifically. So Corey will show you some of the highlights of what we've been able to achieve there.
Great, thank you. So this image is an excerpt or a partial version of one of the data tables that is included in the SRTR OPO specific reports. This is one table out of many, out of very detailed reports that are prepared and made available twice per year, so updated twice per year. And the content of these does include the information that was requested. So this particular table is giving data specific to individual donor hospitals in a particular OPO. The content here, or the specific columns of data, is evolving and will continue to evolve. In particular, the way referrals are measured is sort of an active area. So as changes to some of these data collection and definitions are implemented, SRTR will be incorporating any needed changes to these forms. But we have, at least in the case of donor hospitals, the information is available in existing reports. And the next recommendation here, to provide data on acceptance and decline patterns. This is a type of report that has also been available previously, and it includes some of the types of information that was in the recommendation to compare the performance or the behavior, I guess, of different centers to national averages, which is what's shown in the metrics here. And for this particular recommendation, I think we've long sort of acknowledged that the original intended audience for this report has been more focused for professionals as part of more of a quality improvement mindset. And we do certainly have interest, and we've been brainstorming and planning different ways to explore a sort of translated version of some of these statistical terms that might be easier to interpret for the public or patient audiences. So that is definitely ongoing work where we would look forward to continuing to engage with patients to learn about the best next steps to take this into a more patient-friendly future.
Great, thank you, Corey. The bottom half then of our system map focused on the yellow component, which is the living donor process through the system. We had 23 living donor recommendations, 5 of which we have completed, 5 are in process, with 4 remaining and 9 deferred. I would say that most of the focus at the SRTR level has been with our living donor collective. And I will turn it to Dr. Hart for some comments about that. Dr. Hart is our Deputy Director at the SRTR and has been instrumental in leading this effort along with some key staff members here within our team, and also Dr. Krista Lentine and Dr. Amy Waterman serving to guide this. And so I will turn this over to Dr. Hart for some thoughts about recommendation U7, which was the long-term outcomes of living organ donation.
Yeah, thanks, John. In response to this clear recommendation that came up multiple times during the consensus conference, we've really been able to partner with the OPTN to work on implementing this on a larger scale. So we heard loud and clear that we need more long-term follow-up of living donors and living donor candidates to better understand and serve our living donor community. And the big update is that while the Living Donor Collective historically was a voluntary registry, it was data collection in addition to all of the other required data collection. There's now a policy proposal to have all living donor candidate data, living donor candidates entered into this registry so that all living donor candidates across the US could be followed forward, both through follow-up questionnaires for those who are willing and interested in participating, but also through long-term data linkages so that we as a community can learn more about those long-term outcomes. In addition, the SRTR Living Donor Collective also has now a living donor steering committee that has been, again, putting in an incredible amount of time and work and volunteer hours to give feedback on both what long-term data should be collected. So we know if we send a 300-page survey out, nobody will answer it. So we need to prioritize what really are the high impact long-term data outcomes that we would collect directly from living donors and living donor candidates. And also how to better engage with living donor candidates and living donors so that they are aware of the registry, that they understand the reason for it, and are excited and engaged to participate. So those are the big things that have moved this forward, I would say, from the 2022 consensus conference. I think the community heard loud and clear that we need to do better as a community to follow our living donors and living donor candidates long term.
Yeah, thank you so much, Dr. Hart. And the team here has been, it's been a great partnership with the OPTN's Living Donor Committee and helping to support their public comment proposal, which just last week went out for public comment. So I would encourage you to review that on the OPTN's website. If you navigate to their policies pages, you can find a link to the public comments that are out. And the one you will see is the efficiency and capture of additional data for living donor. And I think the details are in that, but would encourage you all to engage with that. And we will continue to partner with HRSA and the OPTN on this important initiative. As Allison mentioned, there were a lot of recommendations in our 2022 consensus conference about the imperative to make sure that we're doing right by our living donors and learning what we can from them to make it better for future living donors. So thank you to Dr. Hart, Caitlin Neistat on our team leading that effort, as well as Krista Lentine and Amy Waterman. It's been a fantastic project. We're looking forward to the results of the public comment period and what future data will be collected into that system in the future. So thank you very much for that, Dr. Hart. I mentioned early on in the webinar that we have much more detailed information on all 160 recommendations. You can see a link here. There's a QR code in the bottom right corner if you want to scan that. And there's also a link to a document. You can see that on the very last line of this page here that gives you, for each of the 160 recommendations, our latest in terms of how that recommendation is being addressed, some detailed information there. And if it was deferred, if you saw a number of recommendations that landed in this deferred category, detailed explanations as to why we currently are unable to address that recommendation. So I would encourage you to go there if you have specifics, recommendations that you're interested in to see more detail about those recommendations. I mentioned at the start too that given that we cannot certainly cover 160 recommendations in our hour together, I would encourage you that if you have any comments or specific feedback about any of those recommendations in that document, we'll put up a way to contact us in a moment. If you have questions, you can put them in the Q&A here. We will certainly, if we aren't able to address them here, we can address them uh, on the website. We will post responses to what questions we've received through that process, and you can always email us as well. So at this time, I will turn it back to our Communications Director, Mona Shatter, to close us out. Mona?
Yeah, absolutely. Thank you, John. So before I get into a couple of the questions that we received, I just wanted to remind everyone, like John just said, if you have questions, please email us at srtr@srtr.org. Follow us on X and on LinkedIn, and of course, subscribe to our YouTube channel. A recording of this webinar will be available on our channel in the coming days. And following us on social media platforms is the quickest way to get information that we're putting out there. And of course, sign up for our newsletter if you're not already subscribed. John, one of the questions that we received was, are these decision aids available for pediatric patients? I'm only seeing adult information.
Yes, this is a good question. Many of the recommendations were specific to pediatric candidates. The tools that are launched now are focused on the adult population. We are in process of working on pediatric components for some of these as well. There were a number of recommendations about data specifically to pediatrics, particularly in the multi-organ component as well as the long-term outcomes component. So those are still in process, and the decision aids and tools that are there now focus on the adult population.
And John, I believe the soon to be launched long-term outcomes calculator that we did review allows age selection below 18, so it would provide estimates for pediatrics.
Right. Thank you for that clarification.
I would also say that some of the decision aids that have more than the calculator component, that have guides to how to use the data itself, also really required collaboration with external funders because it started to go outside of the scope of the SRTR. And so to some degree, if we want to do some of those pediatric decision aids that have information about how to use the data, we can do some of that with SRTR, but often that requires, looking for an external funder source.
Thank you all. Another question we received was, does the kidney waiting time tool include living donors, or is it only deceased donor renal transplantation?
So,
Sorry, go ahead, Allison.
But we censored at living donation, so we don't want to assume when somebody's waitlisted that we know whether they're going to have a living donor. But the idea of the calculator is to understand what your likely outcomes are on the waiting list if you don't have a living donor. So that calculator is largely driven by deceased donors, but it does include some living donor data up until the time of their transplant.
Thank you. Do you have separate trainings to show how the predictive tool works? Perhaps a train the trainer approach?
That's a great question. We have been in process of creating a number of educational videos, and we I think have gotten a fantastic team that is adept at spinning up those videos rapidly. And given that this predicted wait times as an example, we just launched creating that video. I think if that would be helpful, is something we can take on.
I will also say our Patient and Family Affairs Subcommittee is really fired up about serving in that function for patients, donors, family members, deceased donor family members. And so that's another resource and a group of people who are excited to help patients access these data.
Thank you. We received a question for all the presenters. What is the number one takeaway you think patients should be aware of from this presentation?
Well, I would say one of the things that has always struck me from our patient population is I didn't know about data that are available to me as a patient until perhaps after I received my transplant. Then I was aware of some of these tools and resources. And Dr. Ernest Davis, who now leads our patient affairs subcommittee, has been instrumental in teaching me the importance of trying to get that upstream. And so I thank him for that and all of the patients that have participated in our focus groups and patient affairs committee over the years. We have done, as Corey showed in some of the search engine optimization and other links out to other organizations, we have really been leaning into ways that we can make this information easier to find for patients at the earlier in their journey, as soon as they are perhaps identified as a potential transplant candidate. What information can we provide to them, and how can we try to make sure that they are able to find that information? It's not an easy lift, but we have certainly been focused in that. And our current Patient and Family Affairs Committee has essentially made that their number one objective, is to continue to find ways to make that information more available through partnerships with other patient organizations, the providers that are referring patients into transplant programs. How can we continue to get that out there? And so I hope one takeaway from us is, in addition to how we've really focused over the past 3 years at developing this patient-friendly website and these tools, it's beyond that. It's how do we actually get that information out there? We have a listserv of many patients now that we engage with, and if that's you out there that want to help us spread these words, certainly get in touch with us through that email address there, and we can add you to that list. We also bounce ideas off that listserv from time to time. So I guess that would be a takeaway, is continue to provide feedback, continue to lean in with us in terms of how we can get information into the hands of the people that would find it most useful at the time they need it, not after they already have received their transplant. So that would be my take. I'm sure Dr. Hart and Corey might have an answer there as well. But
Well, we're at time, but I would second all of those points.
yeah.
I'll third all those points. There's never going to be an end to the work that needs to be done. And I think a huge part of this process has been changing our process and really engaging early and continuously and turning into a continuous improvement kind of organization. So if you're on our listserv, you will get emails and we will ask you to give us feedback on things.
All right, we are 1 minute, almost two, over the hour. Thank you so much. Thank you so much, Drs. Hart, Schaffhausen, and Snyder. This webinar is being recorded and it will be available, just as a reminder, on the SRTR YouTube channel. If you find that you still have questions, please email us at srtr@srtr.org. If we did not get to your question, our apologies. We do plan on posting the responses publicly. Thank you so much. Have a great rest of your day.